So, hello everyone. My name is Zoe. I am the program coordinator for the MS in Global Health program here at Georgetown University. I am joined here with three of our now alumni of the program, and I'm going to go ahead and pass it over to them to introduce themselves and talk about their experience abroad. Most of them just recently got back from their abroad module. So I'll start off by passing it to Dr. Diana Evans.
Hi, Zoe. Thank you. Well, so happy to be here. So my name is Diana. I have a medical background from Mexico, and I decided to join the Masters of Global Health because after like working in different like settings and countries, I like kind of realized the need of like the focus on different like health issues, and that really caught my attention when I saw the program and the opportunity in Georgetown to go abroad. I really really wanted to join. So the like I had the chance to go to Hyderabad, India, to the National Institute of Nutrition. Uh, I was looking something related to non-communicable diseases and talking to when we were talking to a program director and decided like this trying to make the decision where should we like where should I go. I He like suggested me to apply to go to Hyderabad, India, to the institute. And um it was just such a great experience. Like after I got there, it was like honestly, it was a process that I thought it was like fair. You kind of like get lost at the beginning, but then you find your way, like through the process, and then it gets easy. Then you get there. Then, I was working with a lot of like scientists there, and I was also learning from other people there a lot because I will be like joining some other meetings where they will doing all these like different projects on different topics, all related to nutrition, but overall different topics. So I get to see how they were managing like, stunting in one of the, SDG goals from India is to like get lower, like decrease their stunting rates. So I hear how like they were managing that project. I was like part of some of the meetings, and as well I was doing my own project. So I decided like when I got there, I had this like supervisor doctor who decided to focus on obesity, to focus my project on obesity and diet related NCDs, non-communicable diseases. So I will go to the field to visit schools and like see and talk to professors, principals, and also to the kids to understand the environments in school and around the schools to see the risk that the kids were immersed to increase the rates of obesity. Because that's another of the big problems that India is facing now. Like their obesity rates are increasing like also substantially. So exponentially, I mean. So it was a very interesting experience. I also had the chance to like travel a little bit in between. I went to when I had a chance, I was able to take a break on the weekends and go and visit. I visited the Taj Mahal. I visited other states. I visited my colleague that was in the vector-borne disease center in Pondicherry, in India. I'm sorry. So I was able to do a little things too, cultural experience. I was able to like, meet a lot of people, a lot of scientists. They're working on other projects. So it was really great experience, I will say. And yeah, I highly recommend people to do it too.
Wonderful. Thank you so much. So now I'm going to go ahead and pass it over to Ruth.
Hello, good morning. My name is Ruth. I come from a legal background. I have moved to a bunch of places, and I always found a lot of value in just going to a new place, getting to meet new people, and just being open to new experiences. And that was what drew me to this master in particular, was that opportunity that of going abroad for a few months to do the research study. So I don't know if I thought I have a legal background, but throughout the master's, I focused mostly on sexual, reproductive, and maternal health. And that's what I decided to do my research in. So I went to Ho, Ghana, left in August, came back in November. and went back and forth through different topics, but at the end settled for comprehensive abortion care. Did a qualitative on comprehensive abortion care. So yeah, I don't know, I don't know what else to add. It was a really, I think we had early before we all left, we had this presentation where they explained to us kind of like the process of that you go through when you go to a new place. So first you're really excited, and then you go through a phase where you're missing home and you really want to go back, and then you're like angry at everything, and then it takes a few days, a few weeks before you finally find your way, and then you feel comfortable at the place. I always felt like I've moved around so many times. This is not going to happen to me. It did. And I think it happened to everyone. Everyone that I talked to really felt that they went through each one of those phases. But I guess that goes to say that I think you find your way at the end of the day. For sure, the initial part was so confusing, doing the interviews, not really knowing what any of it looked like, what any of the opportunities looked like, and what they would bring. I think you can fall back on the fact that you can find your way pretty much anywhere. And if you really want to, you have an idea of what you want to do, and you push for that and you fight for that, you can make it happen in some way or another. Even if it's just a small aspect of that, you can make it happen. Um, so yeah, I think at the end of the day, the process was just really fulfilling. And it also definitely brings a cohort together, knowing that everyone is in the same boat. We're all going through the same, and no one understands better than our peers who, even though they're in different countries, yeah, they're experiencing pretty much the same thing. So that was also really nice getting just, even though we were very far, getting a lot closer to the rest of the cohort.
Thanks, Ruth. And now I'll pass it over to Mara.
Hi, thank you. Like happy to pass. I'm happy to end off after Diana and Ruth. They did a wonderful job introducing the program itself, but more importantly, like the abroad portion, which is a big component of both our ending of the program scholarly paper and what we're leading up to doing with our classes. My background itself is in neuroscience and global health. Um, I'm planning to go to medical school, and so before then, I very much want to get a kind of holistic view and the proper training in school and skills to be able to be a global health physician, to be an international practitioner in settings where maybe physicians are not as well understood or they're not available. So I was very, very happy to say that the program, I think, has equipped me in a lot of ways and cemented that desire of mine to be a physician in international settings, but to also be involved in international policy matters, and things that are maybe not as tangible usually when you're, firsthand just caring for a patient. In this case, you can care for the patient, the physician, and the community as a whole. Um, the classes were fantastic the first year. And just like Ruth and Diana were talking about, then we had our interviews going into, in the process itself, starting to be able to work abroad, essentially. And I got the really fortunate opportunity of being able to work in the WHO country office. WHO is the World Health Organization in Kuala Lumpur, Malaysia. And I was also there for a few months, and it was in the capacity of a health policy and financing intern. What actually was that I was working within health systems, and health systems basically encompasses everything from financing to labor to people to human capital, to policy to whatever else you can think of. So it was a fantastic position because I was able to work with these top health professionals at the World Health Organization, not only in Malaysia but around the Southeast Asia region. But work on projects that had to do everything from primary care, maternal health, to basically legislation that need to be passed to increase funding for health. And so it was very humbling and very noteworthy that I was able to work with people from the Ministry of Health, to work with people from the UN, the United Nations, and it really expands the scope of what it looks like to be in global health, and on the scale of not only just firsthand and tangibly, but also at the same time, all these wonderful people working behind the scenes to pass legislation to promote health equity, to find those gaps that are unvaccinated, to do whatever else you can think of. Um, and they're all very passionate, and there are those individuals that will always look up to. So I found mentors and friends within them all, and I'm glad to say even like the first mentioned the cohort getting closer, like while we were all gone. I think um, very grateful that the year before our cohort itself, as one of the perks of Georgetown is that we have smaller cohorts. Um, so competitively getting in and then being with this small group and then also getting to work with the cohorts from before and then all going abroad together, it makes it all like a very tight knit community the whole time. And that's something I very much appreciated because than your peers. And although you might go through stages, I feel like the overall stage is like a excitement, at least I can speak to that. And um, that you're able to be here for this amount of time and make the most of it, um, and work with all these prestigious organizations, whether you're doing primary research where you're partnering and doing the work yourself, such as Ruth and Diana. Actually, no, Diana and I did secondary research. So working with actually, I did secondary, they did primary, but working with secondhand, being able to assist on different projects, kind of being like a piece in a whole, which is very, very rewarding. Honestly, an experience I don't think I get anywhere else. So, yeah, I'm very thankful for our worked out, and crazy to say we're alumni now, and we're done. So, happy to always chat with prospective students. Imagine this is the way to go. I considered various other public health programs, MPH, and um, I'm very glad I went with the MS in global health because I think it gave me a much better lens and view, especially as someone who is going to go to medical school and then someone who wants to be a physician, but also someone who just wants to work in global health. We have so many opportunities pipeline forward. It really, I think it prepared me well. So, yeah.
Thanks, Mara. And so kind of looking at that abroad experience, I know we briefly touched on it, but how do you think the program helped prepare you for that experience, academics wise, but also socially and culturally? Do you think that there was stuff that this program overall did to kind of prepare you for your placement, but then also make sure that you felt comfortable making that transition? Anyone that wants to answer can feel free to unmute.
I can talk. I can start really quick. Well, I think it was like the program does prepare you for whatever like we're gonna be doing. Like for me, in my experience, I think I was able to, like the all the professors. There are obviously some professors more than others, but a lot or all of the professors kind of like gave me, or the classes that I took gave me the tools like that I needed to like use and conduct my research there. So to me, I love the classes I have. I'm very grateful to many of my professors because I think I learned so many things that were so valuable for me to be able to carry and use them when I was abroad. And yeah, so I say like, like it was to me really it was easier to kind of like dive into this like world of research and in another like in an international organization to be able to perform well with all the tools that I learned from different classes that from that we had in the program. In regards of how Georgetown prepares us to go abroad, I think we get enough like like insights. I think you also have to understand that we are grown-ups, that we have to also take responsibility for ourselves and find our way through, and they are not gonna like baby like sit us while we're there. But we had good communication. We were able to reach out whenever we needed to, like either like Lisa, the program coordinator, or the program director, or Dr. Lisa. So it was a great experience overall. I think it was, you're afraid, like Ruth and Mara said, you get like a little bit scared at the beginning, and you get like excited too at the same time, and you know what you're gonna be facing at the beginning. But once you're there and you start like knowing like or getting to know the people there and the environment that you're gonna work, it gets easier and easier. And I think this is a good way for us to get a little bit of a sneak peek of what really global health is, like the specifically going abroad. It's what we need and what you're gonna know when you're gonna know if you're gonna be ready to work in global health or not, because it's different when you go and work in different other projects when you go abroad. And we all probably have back like experience working abroad or like visiting other countries, and we all love to travel, but once you're there, you live there and you see you're like having a daily life experience. It's a different world, but you love it. I mean, at first you can get frustrated, but then I guarantee you that are missing our times like back there when we were abroad. So
I can go next. I think I would like to add on. I agree with everything that Diana said. I think we definitely get the tools. And if not, you can always reach back to the professors that gave you those tools in the first place. So for me, throughout the 3.5 months that I was there, I reached out to pretty much every professor and talked to them about some gap that I needed to fill in, and then they would direct me where to look at. And that was definitely really, really helpful. And also, there's some professors, I think most of our professors are internationals, and they have worked all around the world, and they always share these little stories about how it was, their perspectives. And I think that really helps set the mindset of what you're going to experience. I mean, at many points I would think back to something that they had said during class. So I think they give you kind of like the formal tools on paper, which is all these the theory pretty much, but also with the stories that they bring in. They give you this, I don't want to say soft skills, but kind of, that you rely on while you're abroad. And that the fact that you can always reach out. I mean, I'm still in touch with many of them. I'm job searching now, and a few of them are helping me in this process, which is really, really nice.
I'm not sure if I have anything else to add. I think they said it pretty well. I think I can speak to, I guess, the comparison in the master's versus in the global health versus the public health, in the sense that at least the global health and the reasons in master's science, and what I really like coming from science and humanities background, um, is that you have courses such as epidemiology that go in depth, but also you have the opportunity to do things like health policy. And so you get a very large breadth of your curriculum, and you have your core classes, but you also get the ones that you choose yourself. And for example, like my interests were, yes, in non-communicable diseases um, and health policy and management, actually. And so I tailored my classes based on those. And a lot of times, that you have for the content, but you also have for these professors too, who, yes, I get firsthand um, experience and have worked, most all of them have worked with international health agencies for over 20 years, or physicians first and foremost, or PhDs or whatever else. Um, it's a trickle down effect coming from the faculty to the courses to then the students too, and exuding the skills that you see them do as well. But the curriculum itself, it does give the opportunity to have at least a bit of knowledge in each thing. And like Ruth said, and you can always, are always very open to reaching out, and will still give opportunities even after you're gone. So um, very, very welcoming, I should say, and supportive.
Thank you all so much. On that note, I think we're going to go ahead and close this out. I hope everyone enjoyed this and hopefully got to learn a little bit more about the program. But as always, please feel free to reach out if you have any questions or concerns, or would like to connect with any of these wonderful alumni.